So looking at hydrotherapy, theory and practice, part 16 in our ongoing series here, looking at various aspects of hydrotherapy. So just an important note, as you navigate any health challenge, it's always recommended that you have a practitioner that has a similar philosophy of care that you do. And it's important that be the case, so that as you develop your plan, that any medical advice that you have, they're simply tools that have been used successfully by others in similar situations. And always investigate for yourself, not accepting anything blindly. Thomas Edison said in January 1903 that the doctor of the future would be not giving any medicine, but would be teaching the patients how to care for their bodies and what they eat and cause and prevention of disease. So our next area that we're looking at here is alternate hot and cold, and particularly in this section here, the spinal application. So we can see that that's being done on the person on the bottom there, kind of a broad spectrum heat area to the back, but we can also do it right to the spine. So it functions as a revulsive compress. We've talked about that in the past, and instead of using the cold, you're going to use ice cubes to do the cold aspect for the in between the hot fermentations. So you have a regular hot fermentation that's interrupted by a cold ice rub. So the benefits: it's a very strong stimulant and tonic. So a tonic is anything that tends towards health, and it stimulates the body, particularly in the circulatory system aspects. It's useful for many types of different situations. It improves circulation overall, increases muscular tone. So if someone has some flaccid muscles as a part of some debilitation, this can help to bring tone back, and it stimulates the vasomotor nerve activity. So the vasomotor nerves are those nerves that particularly control blood vessels and the heart. So this is a picture of the spinal column. Not all the blood vessels or the nerves in the spinal column are vasomotor nerves, but a large proportion of them are. So they're vasoconstricting, vasodilating both arteries and veins, and also functioning to speed up and lower heart rate as needed. And they're part of the sympathetic nervous system. So the sympathetic nervous system is reacting to environmental stimuli. So to apply that fomentation, you want to apply to the spine beginning with a hot fomentation, and you're going to leave that on for between 3 to 5 minutes. And that range of time is based upon the tolerance of the individual who's having the application done. You're going to be using boiling water. You're going to have a towel that's dipped in and wrung out. And typically you'll have a nice thick towel that you'll grab at the ends and kind of twist it up and then dip it into the water. So you're holding the ends that aren't going to be getting wet. And then twist it out and finish wringing it out once you get it out of the water, and then place it inside of an insulated toweling to make your packet, your fermentation packet. Then place that over the person's back, over the spinal area, and then have that 3 to 5 minute period of application of the fermentation. So at the end of that period of time, whatever the tolerance level is, up to 5 minutes, then interrupt it with an ice rub. So grab some ice cubes. It's going to be a quick shock to the system, circulatory system stimulation, 3 to 5 times up and down the spine, and then go again, starting for 3 cycles. So you go back to the hot. But before you reapply the fermentation, so that's boiling water again, that's really, really hot, but it's inside of a insulating towel. You want to make sure that you dry the skin off in between applications of the fermentation after icing. So naturally, that hot skin is going to cause some melting and some water to form there quickly. You want to make sure you wipe that off, because that water there, if you put that hot fermentation on again, it can cause burns because it's going to change to steam quite quickly following that. So steam is much hotter than the water itself. So that's why it's important to do that in-between wipe down before reapplying the fermentation. So be ready to immediately reapply the hot fermentation for the next cycle. So staging is everything in doing hydrotherapy. You want to have your supplies ready. You want to have the next steps set up. You want to have it thought through. You want to make sure that you've shared with the person you're working with what the process is going to be, so that they know what to expect, and walk them through it, and just be efficient about your moves so that things can move well, and that the reaction can be optimally achieved. So local hot fomentation, or hot application, is the next variety here of hydrotherapy treatment. So it's a hot fomentation treatment. You're going to be applying moist heat to some part of the body. So it can actually be done on any extremity or core area. The moist heat comes up from the wrung out towels from the boiling water. So you can see that they have staged there in this particular picture a bucket of ice water. They have a bucket of boiling water. They have their towels that they're going to put in the water to get boiling hot water onto. And then they have the insulating towels there too, and the wipe down towels. So you want to apply it to the area that's affected, and it really can penetrate deeply into the body and help increase circulation and benefit those areas. So it can be a dry heat or a moist heat. So if a person is feeble and not able to tolerate the moist heat, you can do a dry heat. So a dry heat would be applied either by warming up the towels very hot, or you may be familiar with a thermophore type of application, which is an electric heated device that can also do that. And thermophore is dry. It's not wet, but it can still create sweating that takes place. The moist is the most powerful application, and it's often used for local pain situations to great benefit. So pain relief is a key part of it. Insomnia relief is found when you use it for a longer application with less heat. So you could let it taper down and keep it on for a much longer period of time than 3 to 5 minutes. And that can help a person fall to sleep. It actually increases blood circulation, both the white blood cells to the skin, and can relieve internal congestion. So that's low blood flow. So congestion, just like a highway that has lots of traffic on it, everything slows down to a creeping halt if there's any kind of obstruction, or even if it's a perceived obstruction like a Gaper's block. It can end up slowing things down. That's traffic congestion. But we have blood congestion in the blood vessels. If we have low blood fluidity, so that's something that is important. Hemorrheology is the study of blood flow, and we can do things that slow our blood flow down by what we eat, particularly if we have high fats, and other dietary factors can really thicken the blood up. And we want to have thin blood so that it can flow efficiently to all the different various organs of our body and the most distal portions of the tissues. So low blood flow from a blood viscosity standpoint is important as well. So muscle tension and spasm relief is another benefit, a muscle and joint pain relief. So if a person has arthritis or other joint pain, it can be helpful. Internal organ pain relief. So many times, someone will have a tummy ache of whatever kind, or a side ache, and applying heat to it can help relieve that pain and helps them fall asleep and they wake up better in the morning. It doesn't always work that way, but it certainly is a step that can be taken that is low cost and no drugs involved. It promotes sweating, which the sweating process, our body's largest excretory organ is the skin. And so the elimination of toxins through the skin is something that can also occur when you bring the skin area into a sweating mode of operation. So the temperature of the application determines if the person is relaxed or stimulated. So stimulated would be a higher heat, relaxed would be a lower heat for longer. The higher heat would be for a shorter duration and would result in stimulation, which essentially not only nervous stimulation, but a circulatory stimulation, so increased blood flow. So if we leave it on for a longer period of time, you can see the picture above here. They have some plastic wrap over it. That'll help just keep from getting other things wet. Also will help to retain some of the heat. So it's very helpful for chest congestion, colds, bronchitis, even pleurisy. Pleurisy is the inflammation of the lung exterior lining. So your lungs are in their own sac that as you expand and contract your lungs, it slides inside that sac. And when that gets inflamed, it can cause those membranes to stick and can be very, very painful. So I remember as a kid having localized fomentations. They're applied by my mother on my chest, hot fomentations, when I had some severe chest congestion. And even on through different times of my life, have used hot fomentations to the forehead to help relieve nasal congestion. So the supplies needed, you can use a kettle or a steamer of boiling water, 4 fomentation towels, 2 Turkish towels. So those are going to be towels with a thick towel with a good heavy nap on them, and a washcloth, and a cold water basin. So those are going to be your basic supplies that are necessary for this particular treatment. So a 50-50 cotton to wool is the best mix, but use what you have available for the fomentation clause. The wool aspect of it holds the heat, and the cotton holds the moisture. So anybody who's an outdoors person knows that cotton is referred to as the death fabric because it holds that moisture. And in that regard, if you get stuck outdoors and it cools down quick after you've been sweating, it can cause hypothermia if you don't have something else to change into. So it does hold the moisture well, and in this application, it's a very helpful characteristic of cotton. And wool, it helps keep retaining the heat even when wet. So old blankets can be cut into 30 to 36 inch square strips and used. Many times they have a multiple type of fabric quality to them. The steamer method requires a lot of care because remember, steam has a much higher heat than does the water itself, because those water particles have been excited into the next phase of state of matter, into the gaseous phase, and it's going to be a higher temperature in order to do that. So much higher heat. So if possible, just best to use the hot water. In fact, the hot water is probably the most readily available anyway. So applying this hot fomentation, you want a warm room. So between 75 and 80 degrees Fahrenheit. You don't want drafts, because that could result in chilling of the individual who is having a therapy applied. You're going to fold the fomentation cloth into 3 thicknesses. It's not a clot, but a cloth. And then hold the ends and twist them together. So you can see the bottom picture. It's twisted, getting ready to be dipped into the pan of water, the boiling water. So keep the hands on the dry ends. And then once it's put in, twist it more to wring out the excess water and hold the dry ends. You don't want the boiling water dripping off and wet. You want it to be fairly hot, dry, wrung out. It's gonna be moist, but it won't be all wet. And then do a quick untwist just simply by letting go of one end and holding out the other, and it'll rapidly untwist itself, and then pack it into the insulating blankets that are then applied to the person you're working with. So the hot fomentation pack, you want to pack it into dry cloths. You can see the diagram up above where they're doing that. If you need stronger heat, you can sometimes add an additional hot pack to it. So you're using more moist towels at a time. It'll create a more intense heat. One pack is made. Once it's made, you can carry that just right to the bedside. So they have a nice table set up that makes it easier to do that in the area that you're working. So you typically want to have 2 layers of protective cloth. So you can see on the individual on the bottom, they've used like a big bath towel that's been folded in half. And they have inside the fomentation pack, which is the moist one. And you have two layers of toweling between the skin and the fomentation. So when you apply, you want to pull back. So one of those is going to be insulating and transport. The other one is going to be pulled back slightly to allow a more direct heat to the patient. But you want to communicate with them about the temperature. Is it too hot? Is it okay? And if it gets too hot, you can lift it and rub your hand underneath a little bit just to kind of help do some cooling. The pack is larger than the area that you're attempting to treat. So this person is having a spinal pack done here again, or a lower back. So it may be a pinpoint place of pain, but the area around it is much larger. You're not applying just a focal a focal point of heat, but a large area of heat application. So depending on where you're working, you may need to transport your fomentations. If it's in a different room or the table's a little ways away, you can use a bucket with a hot water bottle on the bottom to carry 3 to 4 of the cloths to the area of treatment. And they can stay really hot for approximately 30 minutes. So you could do practically a whole fermentation rotation on an individual, because all you need is three sets of rotational towels for that. The typical number of treatments is 3 cycles of hot, cold, hot, cold, hot, cold. If the person indicates that it is too hot, just lift it up gently and rub beneath it until they're able to tolerate it, so it'll cool down, and then just put it back into place. You can also unfold and add an extra layer of insulation to if that works out better. So the outermost towel next to the skin should be changed every 3 to 5 minutes, unless you're just really looking for just a relaxation effect. So that'd be a longer duration and be kind of coasting down in its heat. But if you're doing a fermentation for circulation issues, you want to keep it changed routinely with no more than 5 minutes of application. So if you're doing a fermentation for pain, use very hot fermentations and change as soon as heat is comfortable. So keep it hot. If you're doing it for insomnia, you want to use more mild heat for a longer duration, 6 to 10 minutes. It could be longer than that, although if it's longer, that it may begin to be cooling. You may have a different type of effect that occurs. The spine or the abdomen are the best places for insomnia packs to be placed. So when changing fermentation packs, have the new pack ready and do a rapid change and wipe the moisture from the skin before the next pack is applied. So the change in packs is something that needs to be done efficiently. You want to minimize the amount of time that skin is exposed. So this is not an alternate example here. This is, you're just doing a continuous hot pack. So 3 cycles is standard procedure. Use a wet hand at the end or a washcloth to wipe down the area, kind of as a quenching, and then dry it completely and prevent the individual from having any access to drafts or chilling. So some key points: have a warm room. Take great care with elderly people or children, and just pay attention to their communication, especially if the child can't communicate very well for some reason, or an older person can't communicate. You want to pay really close attention. You want to avoid chilling at all costs. One way to help do that is keeping the feet warm. You can see on the diagram there, the person is laying with their feet in a bucket of warm water while the fermentation is being administered. Wipe them moisture free during each change, and that's primarily, again, because any moisture that's left will be changed to steam and could cause burns that the otherwise hot water and pack would not. So make sure you have efficient, rapid changeouts, and keep a cool cloth to the forehead, neck, and head, just to keep the cranial temperatures in a normal range. And then if anything is used, if this is like a localized area on the face, use gauze to protect the eyes and face if done on the head. In addition, if sweating continues, you can do a cold friction or a wet towel hand rub to help do the cooling down. You can use extra insulation during fermentation on bony prominences. So on the up here, we have an X-ray of an individual who has had a double hip replacement, it appears. So the bony prominence is one place that on the hip, the greater trochanter on the outside there, that could have more pressure, because it's pointed, it's going to have potentially more heat at that particular point, so more insulation. Scars typically are more tender tissue, and so you want to protect scars if someone has like a large scar on the knee or something from a previous surgery. And then those metal implants or replaced pins, they're going to be able to heat up. They're going to heat up at a different rate than the internal tissue that surrounds it. So just be aware of those, and that's just kind of an intake, kind of a question one would ask. Just make sure you know whether they have any metal inside them. So if there's congestion, if they're prone to congestion or fever, keep the head and neck cool. If there's heart disease that's associated with the individual or tachycardia, you can put an ice bag over the heart area. If you're doing a fomentation to the back or other part of the body, just to help keep the heart in a good state. For pain, use as hot as tolerated. Again, and that's going to help with the pain mitigation. And then omit the cold in extreme pain. So, for example, pleurisy can have very sharp extreme pain associated with it. Just omit the cold part of the sequence. So dry and cover quickly versus using the cold quench. So at the very end, you're not going to use that cold application that you would with someone who is not in extreme pain. So to review the steps of the method that we talked about tonight, you can go back to preparingforthetimeoftrouble.com, and you can look there for future upcoming episodes and review past ones and browse for other interesting topics.